3. Type of tuberculosis. Namaskar and welcome back to our tuberculosis awareness series. I am Dr. Rajendra Nanavare, pulmonologist, Mumbai, Maharashtra. In today's session, we will understand the different types of tuberculosis because knowing the types help in a better diagnosis, treatment and prevention. So let's begin. Broad classification of tuberculosis. Tuberculosis can be classified mainly into two broad types. Pulmonary tuberculosis affecting lungs only, which is 80%. Extrapulmonary tuberculosis affecting other part of the body. So pulmonary tuberculosis. This is the most common form of tuberculosis. It affects the lungs and is the main source of tuberculosis transmission through air. Symptoms include persistent cough lasting for more than 2 to 3 weeks, coughing up blood, that is hemoptysis, chest pain, difficulty in breathing, fever, night sweat, and significant weight loss. If untreated, pulmonary TB can be fatal and highly infectious. Extrapulmonary tuberculosis. Here TB affects organs outside the lung. It occurs more often in people with weakened immunity. For example, HIV positive patients. Common form includes lymph node tuberculosis, which is swelling in the neck or armpit, spinal tuberculosis, which is called Pott's disease, having back pain, deformity, TB meningitis, affect the brain, causing severe headache, vomiting, convulsion, confusion, abdominal tuberculosis, pain, swelling, digestive problems, and constitutional symptoms. Genitourinary urinary tuberculosis affect kidney, bladder, reproductive organs. Important. Extrapulmonary TB can be harder or difficult to diagnose because symptoms are less obvious or non-specific compared to lung tuberculosis. Latent TB versus active TB. Latent TB, that is called LTBI. The person has a TB bacteria in the body, but they are inactive or in a dormant stage. No symptom and not contagious. However, latent TB can become active later if the immune system weakens. Active TB disease, the bacteria are actively multiplying and causing symptoms. It is contagious and require immediate treatment. Important point, About one third of the world population may be having latent tuberculosis. Now, drug-resistant TB, brief introduction. Sometimes the bacteria, TB bacteria, become resistant to standard medication. So types, MDR TB, that is a multi-drug resistant TB, resistant to at least isoniazid and rifampicin. XDR TB, extensively drug resistant TB, resistant to even more drugs. Treatment becomes longer, more complicated and expensive. Now in a closing remark, so tuberculosis is not just a disease of the lung. It can affect many parts of the body. There is a big difference between latent and active tuberculosis, and drug resistance is a growing challenge or a concern. Understanding these types help in early diagnosis and better care. In the next lecture, we will explore the symptoms and diagnosis of TB in detail. Please like, share and subscribe to help spread awareness and save lives. Early detection of every type of TB is the key to saving lives. Thank you.